WFM 91.7.
Afternoon. Thank you so much for staying with us right here on Women Radio WFM 91.7. A very beautiful afternoon to you. Hopefully your day is going on well and happy new month to you. It's the first day in the month of December 2023. I hope that is giving you all the positive vibes. All right. My name is Rose Yusuf Kaiser. You're tuned into Women Radio WFM 91.7, Nigeria's first radio station for women and their families. And of course, this is day 7 of the 16 days of activism. Of course, right here, and we've been taking a first responder story right from the 25th of November. So today is day 7. All right. Now, the theme for this year, 16 days of activism, is Unite, Invest to Prevent Violence Against Women and Girls. Now, this is a global campaign which will be on from 25th of November down to the 10th of December, the Human Rights Day. Now, this year, Women Radio 91.7 is spotlighting first responders who provide first-hand help and support to survivors of gender-based violence. All right, to be a part of the program today, you can dial 07000 917 917. Send us a text or a WhatsApp message to 070 317 56537. You can also send in your contributions to our social media platforms, Facebook, Instagram, X, and YouTube at WFM917. Log on to our website, www.wfm917.com. Download our mobile app, WFM917. So today on Day 7 of the 16 days of activism, we'll be discussing a first responder story, work done so far, successes, challenges, and way forward in ending violence against women and girls. All right, and today with me, joining me virtually, is Dr. Zainab Mohammed Ngundo, and she is the Principal Medical Officer, Yobe State Women and Children's Hospital, and a manager at Shifa, that's Sexual Assault Referral Center in Yobe. All right, so we'll just go ahead and meet her and start off the conversation this afternoon. Good afternoon, Dr. Zainab. Thank you for joining us today. Hi, Dr. Zainab, can you hear me? Kindly unmute your mic so we can hear you. Dr. Zainab, kindly unmute your mic so we can hear you. All right, so we will try to reconnect with Dr. Zainab. I think we're having some network hitches there. So let's try to see if we can get in, try to reconnect with her again. All right, so we have Dr. Zainab, and she is from the she's a Principal Medical Officer, Yobe State Women and Children Hospital, and manager Shifa, as a Sexual Assault Referral Center, all the way from Yobe State. And she's telling us, she's going to be telling us their first responder story today. All right, so we are hoping that she gets to join us pretty much soon, and we get to have her talk to us about the work done so far, all the way from Yobe State, as regards to responding to survivors of gender-based violence. So if you've been following the conversations right from where we started, the 25th day, you would know that we have been bringing first responders. That's people who actually get to respond to the survivors of gender-based violence. All right, they get to take up these cases, sometimes get justice, sometimes go to the extra length of making sure that the survivors are well taken care of health-wise, emotionally, psychologically, and all of that. So I'm just hoping that we would be able to, get the story coming from Dr. Zainab. Hi, Dr. Zainab. Are you with us? Good afternoon.
Yeah. Yes. Good afternoon. How are you?
I'm fine, thank you. How's your day?
Sorry for the background noise. I'm actually on transit.
Okay. Well,
Yes.
we will deal with that.
So maybe we may be having network challenges along the way. I'm not sure.
Yeah.
But hopefully we may be having network challenges along the way, but I'm not sure how it will go. But let's try to do it this week.
All right. So let's just head on straight to the discussion for today and make use of the time we have, and hopefully network doesn't interrupt us.
Yes.
All right.
Yes,
So
please.
go ahead and let us know how far so far in responding to gender-based violence, especially in Yobe State, because the Sexual Assault Referral Center now we're talking about is in Yobe. So how has it been so far? responding to survivors of gender-based violence?
Um, I would say it's been actually pretty fine. I became the site manager like 4 months back, but I've been seeing gender-based violence cases for the past almost 3 to 4 years now. Um, Generally in Yobe State, we have 6 tax centers,
Okay.
and then six. Hello.
Yeah, I'm with you. Go ahead.
Okay. We have 6 tax centers in Yobe State, and which one of them I'm the manager of.
Okay.
It's been fair. Just that there are a lot of social norms and a lot of issues regarding awareness and sensitizations of our people down here, as most of us are from the low socioeconomic status, and then um, with regards to reporting of cases and destruction of evidences, we've been having a lot of issues. But Alhamdulillah, things are looking up now with the current situation. There has been increased campaigns for reporting of cases. As you've been seeing, the data has been increasing for the past couple of months now. There are instances where a woman will come in, or a girl or a lady will come in with a case of rape or domestic violence, but with all the evidence is being washed up. But these days, there are like four to five cases that I've seen in the past month where they reported immediately it happened. So we're able to take a lot of samples, and we've seen we have been able to get a lot of findings from them. Yes, and there are. It has been challenging, really. It has been challenging because of the normal of the style, the culture of silence in our area. Immediately this happens, everybody will be like, hush, hush, don't talk, don't say this, don't say that, because of the social norms surrounding that particular incident. They will be acting as if it's her fault she got into that incident, or she shouldn't, or in a case where she has been violated by her husband, either by domestic violence or sexually or emotionally. Immediately she reports the case, and then she will, like, few months after, or maybe the husband has been reprimanded or arrested or things like that. When he goes back home, he will divorce her. So it has been a challenge, and then it's promoting that culture of silence that we are trying to break in our area.
All right. So now, with this challenge and all of the challenges you have mentioned, so far, how have you been able to, overcome some of these challenges? Because I know that it's not all you can overcome all at once.
Of course.
So far, how have you been able to work on some of these, especially societal norms, the culture of silence and all of that?
Yes. With regarding that, we've been able to meet with some donor agencies to maybe fund the awareness campaign we've been going on. We've been letting freeze try to go on, and then with the hello.
Yes, I'm with you. Go ahead.
Okay. So we've been trying to get the funds for the awareness, getting religious leaders, traditional leaders to go into this gender-based violence activism actively. And then with the government support, we were able to have an audience with the Honorable Commissioner for Health, and then he was in full support. He was even at a point trying to integrate the GBV into the state-free drugs program, but we've not attained that yet. We are trying to, because in some centers there is this free drugs program for under 5 pregnant women and then accident victims. They are on the free drugs program. So we are trying to see the possibility of integrating these victims into that free drugs program, because at times there will be there's issues of drugs and medical consumables will not be available for the victims.
Okay.
And then on the issue, there's another issue that we've been trying to see how we can address that as the knowledge gap. There's this huge knowledge gap. We are trying to see if we can retain the trained doctors and medical professionals that have been trained already to see if you can retain them in this sector. Because with the issue of transfers and being out of service, there's this huge gap that left keeping open for that person that has left, and then with no replacement and stuff like that.
Okay.
So,
Okay. All right, Dr. Zara. All right, thank you very much for that, sharing the challenges and how you've been able to overcome some of these challenges and the journey so far as a first responder institution.
yes.
All right, this is Women Radio WFM 91.7, and this is Nigeria's first radio station for women and their families. Do well to be a part of the program by dialing 07000 917 917. Send us a text or a WhatsApp message to 070 317 56537. All right, Dr. Zainab, let's head on. Now, let's talk about collaborations with, you mentioned, security agencies trying to, train and retrain them. Now, how about other responders? Maybe private, talking about non-governmental organizations, talking about CSOs and other stakeholders. How has the collaboration been like, so far to support the survivors of gender-based violence?
I would say it's been fair. With regards to the security agents, they have been bringing in survivors very actively, because at times in a day we will be able to see at least 4 to 5 cases sometimes, and then in a week maybe 10 cases, all brought in by security agencies, and then at virtually no cost, they will transport them for free, and then sometimes if we have something, we'll be able to for logistics, we're able to transport these victims down to our center and things like that. They've been very supportive. So with regards to the issues, there is this FIDA. Yes, FIDA have been very active with regards to this. And then there is, FIDA have been very active. They are fighting for this for these young ladies and women. Other CSOs also do come in, because I was in Abuja this week for the rollout program, and then when I came back to Maiduguri, we were able to discuss with other organizations. We were talking, and then we got to share some data, and then they were they are very interested in this. So when they come down to Yobe State, they will contact me and see how we can further this collaboration. So other CSOs do come in, like the ICRC. They came in, and then we were able to discuss some challenges regarding our SAC center. And then we told them about the infrastructural challenges, and then they offered to renovate it. So currently it is under active renovation with a deadline of 40 days, I think. Yes. And other security agencies, other security agents. So yes, like the correctional services, the Ministry of Youth and Sports, the other ministries, Ministry of Women Affairs have been active in this. Yes, the civil defense organizations, civil defense, they've been very active and very supportive of that.
Okay. All right, thank you. This is what we love to hear in terms of providing support for survivors of gender-based violence, because only one person cannot do it. It's a collective effort. All right, so yes, I can hear you. Can you hear me?
Okay. Yes.
Okay. So now let's get your recommendations, all right, for the government, which this center is part of. Let's get your recommendations for the society too. Religious leaders. You've also touched a bit about religious leaders because you work with them. And then let's get your recommendation too for parents, and then for women and girls. So there are different groups here who are all stakeholders in the support of gender-based survivors of gender-based violence. So let's get your recommendations for the government. What would you want to see the government do more? The society, religious leaders, parents, and women and girls.
Okay, so regarding the government, I would like for the government to take much more interest than they're showing right now. I would like them to take full ownership of this SAC centers, because this one day there is this donor fatigue. These CSOs that are supporting this program, one day they will leave, and then it will be like the state government, the federal government will have to take ownership of this. So I would like them to see that allocate a budget for for these survivors, for these victims. And hello, can you hear me?
Yes, I'm with you.
Yeah, there should be a specific budget allocation, and then I would like to see the government like take more interest in the police, like the TVB tax officers. There should be the TVB tax officers, the legal tax officers, needs orientation on the management of gender-based violence cases with confidentiality to avoid dropouts in the court. And then there is this concept of de novo, where a judge that is presiding over a case will suddenly be transferred out of his court, and then the new judge that is coming in will have to start the case all over from the beginning. Yes, it's discouraging and disheartening, to say the least, because these people have been through a lot, and then suddenly, when it's almost time for a verdict or a judgment to be passed, the presiding judge will transfer, and then the case will have to start again from the beginning, and then it's increasing the cost of transportation, and then the witnesses, doctors will have to go in over and over again. It's not a nice experience, to say the least. It's not a nice experience.
Yeah,
so I would like to see for the government to be more active in that aspect.
Okay.
So there should be training of health workers on forensic evidence collection, training and retraining of them, because sometimes with this, like I said earlier, with this transfers and out of service retirement, there is this huge gap that is left. So maybe if we are able to train and retrain our doctors, our nurses, our counselors, the new one, the old ones, so there will be a reduction in this knowledge gap, and then everything will go on seamlessly, inshallah. Then I would like to see the government maybe create more forensic labs.
Okay.
As our reference lab in the northeast, I think, is in Yola. It's far, and then there's this issue of transport of evidence, and then maybe when it finally reaches the destination, there will be nothing to write home about with the results. You can't be able to say that this is something that is admissible at times, because there might be destruction of evidence along the way. Yes, but with the forensic lab close by, we'll be able to do some of these things. Okay. Then for the society, for the traditional leaders,
yes,
there is need for sensitization and orientation of this on debunking the culture of silence. Okay. Because it most starts at the grassroots. Silence. You'll be like, don't talk, don't say anything. But if you don't report, there's nothing that can be done about it, and then you'll be suffering in silence. You'll be living with trauma for maybe the rest of your life, which is not fair on anyone to do that. It is not right. So maybe if we are able to debunk and abandon this culture of silence, it will help our people a lot. Okay. Support them emotionally, and sometimes even financially, because it happens to people of low, very, very low socioeconomic class, and then people living with disabilities. I would like to see integrating, like say, maybe the sign language. Okay. If we are able to teach our first responders the sign language, the police, the doctors, the nurses, the counselors, so to be able to communicate with the people living with disabilities seamlessly, it will help a lot. Okay.
All right. Dr. Zainab, thank you so much. So how about parents, women and girls?
Yes.
What would you want them to do better?
For parents, like in our area, there is this the father, being the head of the house, will have like this aloof presence in the family. He doesn't really, like in most families, he doesn't really pull the children close. And then lack of pulling these children close will alienate them basically. And then when this happens, they will not be free enough to discuss it with their parents. And then most of the times it will be the mothers who will notice that something is wrong with this child. When she's beating them, she will see some marks, and then she'll ask about it, and then that particular kid has been scared already, don't tell anybody. Don't tell anybody. I will hurt you. I will help your mother. Then she will keep quiet. Maybe you have to beat her or threaten her. That's why she'll able to open up. And then for me, that's not being like that's further pushing the child away. Pulling our kids close. Maybe limiting the number of kids we have so that we're able to be with them like truly, truly in all senses, in all matters, in whatever case it comes. Be with them, show them empathy, and pull them close. That's when they'll be able to open up and talk to us as parents, as women. For kids, for parents, for women, what this culture of talking going around late at night, because there is this case I saw. It happened like 11 p.m. A 9-year-old was talking sachet water, and then he called her. He bought some from her, and then he went ahead and violated her. By 11 p.m., you're still walking around. It's traumatic. It's sad. It's depressing. It's frustrating to say the least.
Okay.
So maybe if the fathers will be able to take charge of the house, be with the kids, be with the wives. There's this another case I would like to share where a 7-year-old woman was violated by 3 men. It's depressing. She was like mute for almost. I was talking to her during the medical examination. She wasn't able to respond. She was crying. I was crying. Everybody around was crying. It was emotionally distressing. So for parents, pull your children close. For women, protect yourselves. Learn this self-defense tactics. Walk around with pepper sprays and pocket knives at times. Okay. Maybe I am at the checkpoint. I would like to drop out for now, but I'll get back to you shortly.
All right, we're actually done. We are actually done. So I'll just say thank you.
Okay.
Yes, thank you so much for being a part of the program. Thank you so much.
Okay, you're welcome.
Zainab.
You're welcome. Thank you very much. And sorry for the background noise.
No problem.
I'm on transit. Thank you very much.
Have a safe journey then.
Yeah, thank you. Thank you very much.
All
Bye-bye.
right, bye. Thank you.
Yeah.
All right, so there you have it from Dr. Zainab Mohammed Ngundo, who happens to be on transit, but we know how important talking about this is to each and every one of us, and that's why she had to take this time to be with us right here on the First Responder Story on this particular day of the 16 days of activism right here, which is the day 7. All right, so a very big thank you to Dr. Zainab Mohammed Ngundo, the Principal Medical Officer, Yobe State Women and Children Hospital, and Manager, Shifa, that's a Sexual Assault Referral Center in Yobe. All right, a very big thank you to her for sharing her experience and to you also for being a part of the First Responder Story. Now, a very big thank you to the producer of the program, Esther Alaribe, and the executive producer, Tom Okewale Shonaya. Join us again tomorrow, which is Saturday at 12:05 p.m. as we bring you another First Responder to tell her story. My name is Rose Yusuf Kaiser. To have a great and amazing day ahead and enjoy the weekend. Happy New Month once again. Good afternoon.
WFM 91.7.